Hi everyone, my name is Dr. David Kulla here with Synergy Wellness in New York City. I'm here to discuss Medicare Parts A, B, C, and D, and all the other complicated things with Medicare. So if you are 65 years or older, you are eligible for Medicare, and you should certainly enroll between January 1st and March 31st to avoid any kind of fees. There's a 10% penalty fee for each full 12-month period that you're eligible and you don't enroll. So if you're 65 or older, you are eligible for Medicare, make sure you enroll within 12 months. Otherwise, again, you'll be fined 10%. Now, that being said, let's go into Medicare and Medicare Advantage plans. This is something that's really important to me because my mother, before she passed, I've done another video on this. I'm not gonna get all sobby about it, but 8 years ago, my mother, a woman called her, changed her from Medicare, straight Medicare, with a supplemental plan of AARP to a Medicare Advantage plan. And then when I took her, a couple months later, she was diagnosed with cancer. I took her to Memorial Sloan Kettering, a cancer specialist, and they take Medicare, straight Medicare Parts A and B, with a supplemental insurance, like F or G. So we'll go into all the different parts in a minute. And they ended up not being able to take her insurance because she switched to a Medicare Advantage plan. So let's get into it. Medicare, let's start with Parts A and B. Basically, Part A covers your hospital stay, hospice care, some skilled nursing care. It's usually free for most people because they've already paid into the system through Medicare tax deductions. Now, Part B is the bigger part. Part B covers outpatient care, including doctor visits, clinical services, medical supplies, preventative services, like chiropractic, for example, and you pay your share of costs after meeting your deductible. The deductible is really low. It's about $235 right now as I'm filming this video. It changes, but not by much. It's been around that $225 mark, $35 mark for quite a while now. And once you meet that, then they'll start covering 80% and you're responsible for 20%. Now, the monthly premium, is deducted from your Social Security, okay? So if you've been working your whole life, you're paying into that system. And the more you pay in, the less it is per month. But we've had people saying they pay around 200 and change per month for Parts A and B. Okay, and Part C is also known as Medicare Advantage Plan. And this is something really important. You're seeing on TV all these ads, all these Medicare Advantage plans, got to enroll now. They're trying to push you to do it now. You might even get cold calls. Don't fall for it, okay? I'm not saying don't do it. I'm just saying don't fall for it. I'll tell you why. Medicare Part C is, again, also known as Medicare Advantage Plan. This is an alternative to the original Medicare Parts A and B, which again combines Parts A and B into one plan, but often includes a prescription drug package or coverage, which is Part D as well. So oftentimes it's A, B, and D that you get through Medicare. The other benefits may include dental, vision, maybe some fitness. Aside from that, Part C, it's taking you out of that Medicare umbrella. So with Medicare, you can go, it's a PPO plan. You can go in your network of Medicare participating providers like myself, or you can go out of the network and see any specialist you want in or out of your network. You may pay a little bit more going out of network, but you have that luxury. God forbid you have something like cancer, like my mother had, and needed to see a specialist. And long story short on that, she ended up passing away 2 weeks after that. We had to take her to another hospital, and that slowed everything down, and they popped the tumor, and she died of sepsis. Would that have happened at Memorial Sloan Kettering? Probably not. So there's my gripe there with the whole Medicare Advantage plan. But when you do Medicare Advantage, yes, you may get dental and vision, and you get Parts A and B and the medication. And you may also have like zero monthly fee and zero copays. They entice you that way. But remember this. When you go into an Advantage plan, make sure that the Advantage plan is either, pay close attention to whether it's an HMO or a PPO. Remember, straight Medicare is a PPO plan allowing you to go in or out of network. PPO gives you flexibility. HMO, you can only see the doctors in that participating network. So let's say you sign up for Humana, Medicare Advantage plan. You can only see doctors in Humana. You are no longer a Medicare holder, really. It takes you out of Medicare and puts you into a Medicare Advantage plan by Humana, United Healthcare, Aetna. There's so many other insurance companies that have Advantage plans. But remember, if you get a Medicare Advantage plan HMO, you can only go in that plan's network. Aetna, United, whatever that Medicare Advantage plan it is that you get. They're all sponsored by another insurance company, okay? Now, you can also now, as of recently, last 2 years, get a Medicare Advantage PPO plan. That gives you the ability to go in or out of network like the regular general Medicare Parts A, B, and D. Okay, so I hope that kind of clears things up. I hope you don't get too confused by that. Then you also have supplemental plans that you can get on top of having parts A, B, and D. You can also get a supplemental which will cover the 20% that Medicare covered the 80% of. Okay, so that's another way to get full coverage without going Part C, doing a Medicare Advantage plan. And again, if you do Part C Medicare Advantage, make sure you're deciding properly whether you want an HMO plan, which limits your access to other doctors, or a PPO plan. And that PPO plan will have a deductible, so make sure you check that deductible. I hope this information helps all of you seniors out there, picking the right insurance. This is really important. It's an important decision as you get older and have more health problems, generally speaking. You want to make sure you're insured properly, okay? So thanks for tuning in. If you have any questions, feel free to comment below. Thanks again. Thank you guys so much. If you got anything from this video, or even if you just like this view of the Empire State Building and the Chrysler Building, give me a like and don't forget to subscribe. Appreciate you guys.